Citizen heroes. Stone Age healers. The hunters and gatherers who lived during the Stone Age risked injury every day. They were exposed to many diseases, ranging from the common cold to joint problems. How did early humans deal with sickness and injuries? Early on, prehistoric humans made medicines from herbs. They also figured out the basics of the human body by studying the bodies of animals. Over time, they learned a lot about illnesses and injuries. Healers are responsible for passing this knowledge to the next generation of healers. By about 7000 BC, or even earlier, Stone Age healers could pull infected teeth, set broken bones, cut off limbs, and even perform brain surgery. The healers would perform brain surgery on someone who had headaches or head wounds. To treat the person, a Stone Age surgeon cut a round hole in the patient's skull. Early humans believed that disease was the work of angry gods. The opening in the patient's skull could have been a way for the evil spirit to escape. The instruments of Stone Age surgeons were not much different from prehistoric hunting tools. The flint knives they used were sharper than steel scalpels used by surgeons today. No one knows if the operations really cured the patients. But archaeological findings show that some patients did survive the surgery. This indicates that the surgeons were remarkably skilled. Responsibility in action. Link to current events. Healers have the responsibility to help their patients. Research the story of a person who helps heal people. How is he or she responsible?